name is Soundarya. I'm going to do my final internship presentation. So, my topic is Content Currency Benchmarking Project. Um, I'm going to say a little bit abstract about my internship. So, currently, I'm doing my summer internship with EBSCO Information Services during the summer, and my internship has basically two projects. The first one is to learn how machine learning logarithm is working to maintain the currency that is the up to date to of the dynamite and its performance in selecting the references for the topic. And the second project is to learn about the guideline incorporations into the recommendations in the dynamite, and also comparing them to the key competitors. So, my agenda today is I'm going to talk about my company a little bit, and I'm going to say about my internship description, why this internship is important to the company, how this project is important, and also I'm going to give an overview of internship experience during this process and what I have learned, what are the challenges I faced, and the acknowledgement. So, the company overview, which is EBSCO Information Services, I'm working right now, is a branch of EBSCO Industries, which is one of the country's largest privately held and family owned business. And also, EBSCO is the world's largest provider of research database. And Dynamite is a component of EBSCO. It is a clinical decision resource which is available for everyone, especially the physicians, medical students use it to know the point of care health information. And it is basically like a platform. For example, if a complication like a migraine, if you're searching for the treatment or the guidelines, what are the protocols for migraine, the dynamite shows you the latest research articles and what are the guidelines for specific countries for the treatment protocol, everything. So that is a platform where you can see whatever you want, the latest research articles. And it was awarded as the finest point of care clinical references tool in 2021. So I'm going to give a description about my internship. As I already said, it has two projects. The first project is to know how machine learning logarithm works, and especially the first project was based on the rare diseases, because rare diseases has like fewer research. Few people will be doing research on that, so few articles will be published. So we just wanted to know how machine learning is picking those articles for those diseases which rarely occur. So, and the second project is about the guidelines. First, we thought about doing the guidelines. I mean, guidelines in specific country and how it has been updated. But later we changed to why not all the references, how it is being updated, and in comparison to the competitors. Are we updating it frequently, or the competitors are updating it frequently? So we just wanted to know that. So, how it is important? This project is important to the company because we just, by analysis, we would be knowing that is the dynamite is being updated more than the competitors, because like physicians have to know the updated research. So, in that point, it's helping, and also knowing the performance of the machine learning in the rare diseases, and not only in the general more frequently occurring diseases, but also knowing in the rare diseases how is the machine learning logarithm is working. So the overview of my internship. In my first project, I have analyzed like 500 plus articles on the rare diseases, both from the PubMed and the Dynamite web database. We generally use articles which are published only in the PubMed, because we think that PubMed is a reliable source and a genuine research is there done in those articles. So we basically pick articles which are published only in the PubMed, and also the Dynamite database, because the machine learning has like few protocols in picking the references to the Dynamite database, because Dynamite, the machine learning does not pick all the articles which are published in the PubMed. It only picks specific references which can be helpful. So we just wanted to know in the rare diseases what are the specifications, is can we um, cut down few rules in the machine learning, because rarely the for these diseases there are not any articles. So if we include all those instructions, we'll get like couple. So it's not possible. So we just wanted to know that. So for the first project, I have done analysis in Excel. This is this is like a brief analysis screenshot I have kept here. Here you can see the rare diseases and its probabilities, machine learning position. Generally, the ML position is nothing but the machine learning gives position to these references. So that is that column. Few columns I have done it. Few columns my teammates have done it. And this is the pivot table, which I have done it. Um, I have wantedly made it blur because this is the ongoing project publication, so I don't want to reveal all the numbers and everything. So yeah, this is what I have been doing for. Like in the previous image, you can see the analysis, and in the lower image, these are the analysis which I have done in the pivot table. And this is the publication paper title. Currently, I have done with my analysis for the first project, and also I'm guiding for the making in draft for the paper publication. So this is the title and the authors and affiliations and everything. So second part, I just wanted to say why the second project is important, because there is a protocol for treatment for every disease, for every country. The guidelines are different for different countries, and the physicians and the clinicians who are working in the specific country have to know the guidelines of the country and the updates on that. So this is a really important project to make the physicians aware that guidelines are here, these are the updates. Also, we want to know how frequently we are updating and with compared to competitors. This is the data analysis which also I have done in the Excel. These are the diseases, approximately 750 diseases I'm working currently on. So these are the articles which references which we have, which the competitors have been updated, and I have done few analysis on that. And this is the pivot table. So first one here, you could see that in this picture you could see like various disease names. This is the pivot table for single diseases, and the previous one is the overview. Reflections and what I've learned is, first, I've learned how research database can be so important for the clinicians and the medical students, because again, I have said a lot of times, knowing the up-to-date research is so important, because a lot of research is happening and a lot of new diseases are coming. And for example, the COVID, it's like in 2 years they are like somewhere around 2000 plus research articles only in PubMed. So just knowing what is genuine and updating the news is so important, and also letting the clinicians know about it is important. So the dynamite is helping them, and it was like really eye-opening. And how can a research database can be so helpful? And also I learned a lot about analytic abilities. First, I was an Excel beginner because I was a healthcare professional and I was transforming into the health informatics program. So it's really difficult for me. So I was a beginner. My manager, she was like super helpful. She taught me everything, and I could like say that I'm an advanced Excel right now. So I learned a lot in this process, and also I learned a lot how to communicate in the teams, because in the starting I thought like intern because I my team was like pretty huge. They're like people from Canada and all the professors and everything. So I was like, oh, I shouldn't speak a lot. Then my team was like, oh no, you have opinion, you can talk. I think that was like really cool and helpful. Yeah, acknowledgement is I am so grateful for my manager, which is like Dr. Patricia Kavana. She's a senior deputy editor at EBSCO Information Service and also a associate professor in pediatric department for Boston University School of Medicine. She's like she has the same background as me. She's a healthcare provider, also now working for a research and also doing analysis. So she is like exactly like me, and she knows what I'm facing as a beginner. So she helped me a lot. She helped me to know what are the career options and everything, and it was like really helpful. And I'm also it's like it's an ongoing process. And the only challenge, I never faced any challenge, I would say. The only thing is, like, it's only lasting for 2.5 months. That is the only sad thing, but nothing more than that. And also, I like to appreciate the chip department because the courses which I took in my first semester and second semester was really, really helpful, I would say, because one of the courses in the second semester, which is like clinical decision course, uh, it was about the machine learning thing. I'm not currently using or implementing anything, but knowing the background about it is so important because for my project, uh, is not about doing machine learning, but know how the machine learning is performing. So, I mean, like, I'm not completely blank about that. I know what is that, and I don't know, I know some background about it. So, that course really helped me to knowing the brief about it. Not only that, a lot of courses like SQL, because I learned a lot of analytical skills by SQL. It was like really helpful. And yeah, thank you. Thank you so much for coming and listening to my presentation. It was a great experience, and although it is sad that I'm going to end it in 2 or 3 weeks, I guess. So, yeah, thank you. And also, I'm open for any questions.